Hi, good morning, everyone. I am Dr. Nandini Gokulchandran from NeuroGen Brain and Spine Institute, all the way from India. Good morning to all those who are in India and Dubai, and good afternoon to those who are in Australia and other countries. I hope you're all having a good Saturday. The Saturday has started with a very good morning. And I hope that all of you are safe, sitting at your home, taking care of your children. And we are here to basically talk about how can we improve the quality of life of our children, our near and dear ones who are suffering from various neurological conditions. So NeuroGen Brain and Spine Institute, as some of you would know, is a center in Seawoods in Navi Mumbai area of Mumbai in India, which caters to or treats holistically and comprehensively conditions such as autism, cerebral palsy, intellectual disability, muscular dystrophy, spinal cord injury, head injury, and other neurological conditions with a combination of cellular therapy and neurorehabilitation. And in our endeavor to make these treatments more and more efficient and to help improve quality of life of individuals, we are adding on and evolving the treatment and adding on newer treatments to be able to make a difference in the lives of people. So to go ahead with today's webinar, so why are we here? We are here to understand what is the problem with our child. Many parents reach out to us saying, my child has this problem, I really don't know what the issue is. There are many parents who have already done their research, in fact, know much more than we do about their children and how various factors affect them. But what we are trying to do is trying to put everything comprehensively in one place to be able to answer a little bit of all of these questions. So now, what are the current treatment options or current treatment paradigms for neurological conditions? We are talking more here about autism, about cerebral palsy, and about intellectual disability. We all know, and we have been told time and again by various doctors, various neurologists, all health professionals, all other allied therapists, that there is no cure for this condition. And when we hear there is no cure, obviously our heart sinks. Right? So this is one. The other is there is no surgical intervention. In a child with autism, really, you can't really open up the brain and really correct the wires, right? If that is what the problem is. So there is no surgical intervention as such that you can do in the brain to correct it. There is only rehabilitation. So yes, rehabilitation are the pillars for treatment of various conditions, neurodevelopmental conditions. How does rehabilitation help? Rehabilitation helps in stimulating the brain by training the brain, using the potential of the brain to the best of that brain's ability. So if you look at us, even we don't use our brain completely. We use our brain only partially. There's so much potential even in us, but really we don't train it. Similarly, for our children, they are trainable if you really intervene early at the right time. No really medications to correct the defect, but yes, there are medications for symptomatic relief. So for example, if there is seizures, we can treat or reduce the seizure severity with anti-epileptic medications. Or if there is hyperactivity, then we can give medications to reduce hyperactivity. If there's sleep issue, then we can give medication to help the individual or child sleep better. So medicines will be more supportive and more palliative. So now what is new? So we don't have a cure, there is no surgery, there's only rehabilitation. Medicines have limited value. So what do we have now? What we have is a combination protocol, or what we call as a combination of cellular therapy, rehabilitation, and integrative therapies, all working in a combinatorial fashion. So it's not just 1 plus 1 plus 1 becomes 3. It is 1 plus 1 plus 1 becoming 5, 6, and 7. So that is combinatorial. So they work spatially, temporally, and mechanism wise. All these treatments work in tandem to give us a better result, more efficient than we could think of. So let us take an example of how this would work. Now, yes, I'm talking about the brain, and you must be thinking, why am I showing you a fractured leg? Yeah, it is evident, right? This is a fractured leg. Many of us would have maybe, endured a fractured leg or seen somebody with a fractured leg. And what do we do if there is a fracture in the leg? Do we, just start walking, saying, let's start physiotherapy and the fracture will be fine and we will go back to walking? No. What do? We fix the fracture. Either we fix the fracture with the screw and plate, or we fix the fracture with a cast. Basically, give it time to heal. So first we have to heal the fracture, and only after it is healed that you start the exercise or rehabilitation to mobilize the joint and make the muscles around that joint stronger to be able to walk better. So when this is true for a bone, why shouldn't it be true for the brain, right? So if the brain is functioning less, or if there is a damage in the brain, or if there is a function, or there is a problem or a deficit in the brain, if we start, pushing it too hard, what will happen? What will happen to a fracture if we push it too hard? The fracture increases, right? The fracture doesn't heal. So similarly, we believe at NeuroGen that this is the brain scan, when you see the blue area are functioning less. And that means either it is working less, or it is damaged, or there is a deficit. And we believe that we should improve the functioning of this deficit brain. We should improve the functioning of a damaged brain, help repair it, help heal it, so that when the brain heals, you can see here, the green here indicates healing and improvement in functioning. This healed brain now will respond to the rehabilitation, the therapies much better. So that is a concept that we are going from. The old thinking is that the central nervous system is incapable of regeneration. Okay, so everybody, and for dog years, we have been listening to this, that once the brain is damaged, it cannot be repaired. Once the brain is damaged. And when you hear it so many times, you believe it. However, there has been a change or the shift in the thought process, and this old thinking has been obsolete for 2 or more decades now. I was doing recently, yesterday, in fact, I visited the lab where I did my postdoctoral fellowship, where we study, or the lab still studies developmental neurobiology, how the brain develops. And during that time, way back in 2000s, it was already shown that the brain has capability to repair, to regenerate. The brain has abundant potential to continue to grow. That's how we create memories. How do you think we create memories lifelong? We keep creating new memories. We sometimes have a photogenic memory. We remember things that, even our subconscious has forgotten. We remember, it just comes as a deja vu to us. So how is it created? It is created because the cells in the hippocampus continue to multiply and continue to network. That's how the brain is different from other organs. It's not just about creating the cells, it's also about creating connections, because the brain is a circuit. So the new thought is that, and it is not very new, it should have been, in fact, imbibed even in our brain by now, that it is possible to stimulate a process of cellular replacement and repair in order to give the brain a chance to learn new things, to relearn what is lost. And this is known as plasticity. So it is called, please do go up, look up, neuroplasticity, retraining the brain to be able to learn what is lost or to learn what the damaged part has lost. So the other part of the brain can take over. Children with severe brain damage, individuals with stroke, we can retrain the brain. And cellular therapy helps to enhance this possibility. So cellular therapy is actually an idea whose time has come. It is a time, this is a very exciting time of in medicine, which if we look at it, very closely, that we have that potential which was not available 10, 15 years back. So this is in fact definitely a ray of hope towards a candle burning at the end of the tunnel so that we can get up and start walking. So now what are stem cells? Stem cells, very simply put, is like a stem of a tree. If you look at a sapling, stem of a tree, properly watered, properly fertilized, gives rise to leaves, branches and leaves, and then fruits and flowers. The stem of a tree is like the seed and the small sapling which is coming out, and that can be nurtured to become a full-fledged tree. So stem cells are special cells in our body, which when properly fertilized, when properly given the fodder and the water, these cells can become many different cells of similar kind. So one cell can become 100 or 1,000 stem cells, and then these can mature to become various tissues in our body. Okay, so these cells can, when put in the liver, when they give the right signals, can become liver-like cells. When put in the heart, can become heart-like cells. When put in the bone, can help heal the bone. When put in the skin, can help wound repair. And we are using this for the brain repair as well as the spinal cord repair of the muscle regeneration. Stem cell process per se can be autologous or it can be allogenic. What does autologous mean? That we take from our body and put it back in our body. Okay, so this in fact is one of the most doable possibilities because we are not tampering with any of the cells here. So it is like a bypass, right? We take the artery or the vein and we put it in the heart, right? So this is, or even in bone healing, many a time bone marrow or the bone piece, if you know the spinal cord injury, the fractures many a times by bone graft, one part of the bone, put it in the neck to support the fractures. So that is autologous, taking from our body, putting it into another part of our body. Allogenic transplantation is taking from a donor and putting it into a recipient. Again, so let us listen to Stephen Hawking. I think many of you know who Stephen Hawking is, and let's see what he has spoken about stem cells in our body. So what is Stephen Hawking saying? See, Stephen Hawking was one of the most prolific, renowned physicist, a Nobel laureate of our times, himself suffering from a condition known as amyotrophic lateral sclerosis or motor neuron disease, and who believed in the process of self-healing, the process of healing ourselves through the use of our own power of regeneration via stem cells in our body. So he was a theoretical physicist to put forward this theory, and actually what we are doing is putting that thought into practice. So now, how do these cells work? Many people do ask me, okay, you put the cells, what do they actually do? So let's see what do they do. They multiply. As I said, one cell has a potential to multiply in many-fold. They convert into other type of cells. They have potential of pluripotency of converting into other different types of cells. They can network and form connections like neurons. So here in this picture that you see, this the white bright thing is the stem cell, and that in the culture, this is something which we have done and shown is that in the culture plate that these cells, they become neuron-like cells. This is how the neuron looks, and connect with each other, talk to each other. Okay, so that has been shown and is possible. Most important, they release positive chemicals in our body. They release growth factors. They release um, uh, inflammatory reducing cytokines. Okay, so the immunomodulatory cytokines release growth factors which stimulates neuroregeneration and repair. So this is known as the paracrine effect of cells. They improve blood supply. This is known as neoangiogenesis, formation of new blood vessels. So new blood vessels, when we see there is a wound in our hand, we see there is a redness which happens after that. That is because a lot of blood flows into the wound to be able to give it oxygenation and also release of growth factors which would start healing our skin. So if you just leave the skin like that and ensure that it doesn't get infected, you will have wound healing by yourself. And stem cells in the blood itself are doing this. So the stem cells in our blood or in our body can't reach the skin very easily. However, they are unable to reach the brain because brain is a protected organ. Brain is surrounded by blood-brain barrier. What does that mean? That not everything in the blood can reach the brain. Because it is a very delicate organ, once, as you see, injured, very difficult to repair. And hence it is protected by 3 meninges or a fortress. And that's why not everything can reach the brain. So now, what kind of a treatment option are we looking for the brain? So this is an example that long time back, maybe in the 1990s or before that, we had multiple gadgets for various different functions that we need to perform. For example, for watching television, we had a television, we still do, but rarely do we use it, right? For reading books, we have hard copies. Okay, looking at time, then you have a watch or a clock. Then for hearing music, you have radio. For clicking a photo, you have a camera. For looking at for a light, you have a torch, and so all of this. But now in the 2020s or in the 2000s, what do we have? We have one phone. We have one phone which does everything, and that's how the stem cell works. Stem cell works having multiple different mechanisms of action. So as I said, it immunomodulates. It reduces the inflammation in that part of the organ where we are putting it. So let us take an example of the brain. So it reduces the inflammation in the brain. Okay, it stimulates cell migration. It attracts cells which will repair the brain. It acts as an antioxidant. Okay, if you think about all the wellness things that are going on, what are we looking at? What is the main problem in all the diseases that we have? That oxidation is the problem, and we're all taking antioxidants to reduce the toxins in our body, right? To reduce the effect of the toxins in our body, and stem cell does that by default. Okay, anti-apoptosis. What is apoptosis? It is self-death. So as I grow old, my skin becomes less and less glowy. Why? When I was in 20s, when I was in 30s, or when I was 10s, my skin could repair very fast. Okay, my cells would not die very fast. But now with age, as you go into 50s, as you go into the 60s, it starts sagging. Okay, why? Because the cell death is happening faster. Stem cell, in fact, prevents cell death. It has anti-apoptotic factors. And of course, it stimulates new blood formation and thereby giving that flow. So angiogenesis, formation of new blood vessels happens, and thereby again releasing growth factors, releasing oxygen, which again acts as a anti-apoptotic factor. So all of these together gives the stem cell a multitasker kind of a profile. So now there are a lot of biases about stem cells, which is very unfortunate and which has a historical precedence to it. And in order to understand that, let us first understand the type of stem cells. Okay, because there is a lot of confusion about the type of stem cells and the side effects, and there are myths around, connected with it, even for professionals. So the the first ever, not first ever, but I would say the most disreputed, unfortunately, type of stem cell is the embryonic stem cell. Now, this is the first stem cell that we were ever were. Why do I say that? We were stem cells, right? You and me, when we were in our mother's womb, we were actually stem cells. So we should not really have anything against stem cells. We were born from stem cells. So when the oocyte and the sperm, they fertilized, okay, and they became one, and you were formed, or I was formed, and then that one cell multiplied into 2 and 4 and 8 and 16 and 32, a bunch of cells. Okay, this bunch then divided into what you can see here, a inner cell mass and an outer layer of trophoblast. So this inner cell mass is what ultimately forms the different organs in our body. It becomes the fetus. Okay, and the trophoblast is what forms the placenta. Now, this inner stem cell here in the laboratory, if it is cultured, it can give rise to each and every cell or tissue of our body. It can become a hair, it can become a heart cell, like beating and pumping, pulsating. It can become a bone, it can become a teeth, it can become a intestinal cell, it can become a brain cell. And so when you just let it grow in the laboratory, in a culture medium, you can see these bunches of cells with all different tissues in there. I've seen that. It's amazing when you see that, and it's like pulsating with some of the cells beating like heart. So embryonic stem cells have the potential to form each and every tissue of our body, and they are procured from in vitro fertilization clinics, where couples go to have a baby, okay, when they can't have. So 10 to 12 embryos are fertilized, and then 3 to 4 are put in the mother's womb. The rest go waste. So way back in the 90s, they started using this waste embryos to see whether they can form embryonic stem cells, and research on it. So unfortunately, due to religious biases, in the US, the federal funding for embryonic stem cell research was stopped for new stem cell lines. Okay, and that's where the whole concept of stem cell is banned in the US. That statement started. So it is actually the federal funding for embryonic stem cell research was actually stopped due to religious beliefs by the then president. In terms of clinical or the human angle, yes, there were a lot of human right issues saying that you are killing an embryo, you are destroying a life, and hence the problem. The medical issue is, yes, these cells do have potential to form clumps of cells known as teratomas, and which are benign tumors, and thereby they cannot be used for treatment purpose or clinical transplantation. So that's why we cannot use for treatment of any disorder at present. Okay, but then we have other type of stem cells. So when the West closed the door, the East looked at other options. So we looked at, we know the possibility of cord blood, right? Everybody knows the possibility of cord blood, and cord blood is being saved when a baby is born. So this cord blood is a very good option for blood disorders or hematopoietic disorders, and for brain disorders. Now it is being studied by giving intravenous transplantation of cord blood. So that is one option. And if we don't have these options, many people don't have these options, we do have the option of our own body cells. We have the option of the adult stem cells. Adult stem cells are niches of cells in our body which continue to multiply lifelong. So we have cells in the teeth, we have our fat, which continues to multiply. And we definitely have our bone marrow. Bone marrow is one of the, in fact, the first, if ever, stem cell being studied is the bone marrow. Nobel Prize was awarded for finding stem cells in the bone marrow. That's the first ever Nobel Prize awarded for stem cell research. Okay, way back in 1990s, so almost 30 years back, the studies would have started. So bone marrow is one of the most prolific, one of the most easy, one of the most feasible source of stem cells, which can be today used for transplantation for various disorders, not only this disorder. So bone marrow that doesn't have any commercial value, number one. It doesn't have any ethical issues. We are not killing an embryo. There should not be any religious connotations, again, because we are not touching an embryo. These are our own cells, and will never ever form tumors. That's one promise. It has never ever given rise to, because they are adult stem cells have limited time multiplications. They will not multiplicate indefinitely. They will become adult cells and integrate into the part of the body, whether it's a brain or a liver or a heart, wherever it needs to stay. Okay, so bone marrow thereby becomes a very good source of uh, stem cells, which can be practically, safely, clinically used for clinical transplantation or medical transplantation or treatment purposes. What we have for is a very beautiful concept for which again Nobel Prize was awarded in 2012, which has come recently, known as induced pluripotent stem cells. Okay, induced pluripotent stem cells are the ability of a cell, or it could be a skin cell, which can be stimulated by external means to become a childlike or an embryonic stem cell. So those would be designer stem cells. They can be reprogrammed into becoming very childlike or embryonic stem cell without killing an embryo. So a lot of work is happening on that account, and hopefully soon we will have that, but it is still a few years ahead. So when you know different types of cells, when we say that stem cells have tumorogenic potential, they form tumors, they have side effects, that stem cells are banned, we are putting all of these different types of stem cells I explained in one basket. It's like saying that alcohol and orange juice are all beverages and hence toxic. So how true is this statement? Okay. So alcohol, embryonic stem cell would be akin to alcohol. Yes, there is a possibility of long-term toxicity. However, adult stem cells is like homemade orange juice made with a lot of love, freshly, squeezed by the mother. How can it, harm the child? We can think about. Now, why do we choose to work with adult stem cells in clinical setting, which I have already I'm just summarizing it. It is safe. There are no long-term side effects. It is non-tumorogenic. There are no rejection issues. We are using the child's or patient's own stem cells, so no rejection. Easily obtainable. Okay, very easily. We're using one thin needle. No ethical issues. We're not killing an embryo. So bone marrow is a source of the stem cells that we use in NeuroGen Brain and Spine Institute. And because we're dealing with neurological conditions, we inject them intrathecally. Okay, so just have a look here. This is the brain, this is the spinal cord, and it ends at some point, and then we have all this vertebra. The lower vertebra will have only the nerves passing through. Okay, so the cells are injected here into the spinal fluid after the spinal cord ends. So the cells go into the spinal fluid, and the fluid is flowing all around the brain and inside the brain, and thereby taking the cells once, giving it the route to reach the right place. People ask me, will the cells not go here and there? So you just see the cells are going into the spinal fluid. So either they will be in the spinal cord or into the brain. They can't really go anywhere else. As I've told you, there's a blood-brain barrier. So nothing can go out or come in unless it is, absolutely soluble. So cells are not soluble. So this will not go out. Plus, as the brain, if there is a brain injury or if there is a brain dysfunction, there is some inflammation in the brain. There are certain chemical factors released by that part of the brain which will pull the cells towards it. It will pull the cells towards the part of the brain which is functioning less, and the cells will reach there and start their work. So why intrathecal? Because it is minimally invasive. Just see one needle, one small needle in the back. It is safe. There are no major side effects. Okay, the cells home on to the injured brain. Homing instinct. The cells know instinctively where they have to go. There is no dilation in the other parts of the lungs or liver or spleen or heart or nothing. It will go to the brain or to the spinal cord, wherever the injury is. So if there is a spinal cord injury, it will go to the spinal cord. If there is a brain injury, it will go to the brain. If there is both injury, it will go to both places. So we have had head injuries and spinal cord injuries together as well. So what does it do? So this is just a representation using a PET scan. This is a PET scan. I will be talking a little bit about it later. Brain, the blue areas are functioning less, and they go and go repair. The blue area becoming lesser, the green increasing. So activated brain, we see more activated brain. So what is the scientific basis? As I said, the first ever Nobel Prize in 1990 was awarded for the demonstration of stem cells in the brain. Okay, then in 2007, isolation of embryonic stem cells in the mice to Sir Martin. And in 2012, two scientists got the Nobel Prize for the demonstration of induced pluripotent stem cells. Scientific basis of the work that we do at NeuroGen, 100 plus publications, all of them available on our website, 16 in autism, 15 in cerebral palsy, 4 in intellectual disability, 18 in muscular dystrophy. A lot of work, we've written book chapters in books about stem cell therapy in autism. These are international books published independently. Chapter on cerebral palsy, stem cells in cerebral palsy, stem cell in pediatric neurological disabilities, stem cells in muscular dystrophy. How is the treatment done? Very simple. Not a big procedure, not a big surgery. One thin needle in the hip bone. Bone marrow is aspirated. Stem cells are separated in the laboratory. So what you see here basically is the red part is the red cells which we don't want. They go and settle down. So this goes through a gradient, and what you see is a transparent part, and then the white part here is the cell or the buffy coat, and that is what is aspirated, washed, purified, and injected into the spinal fluid. So let's have a look at how the treatment is carried out. Bone marrow is aspirated out. The child is sleeping. This is in the laboratory. Bone marrow is processed, counted, viability is checked, and then using a very thin needle, you don't even see a mark, the cells are injected. So there is actually hardly any mark, no mark that you see. Aspiration, as I said, this is a processing, and this is the bunch of the cells, which is then diluted in CSF and injected. Counted, injected. So now let's look at autism. We know what autism is, many parents know, but still just to review, it's a neurodevelopmental condition. It is a spectrum. Okay, so no child is like any other child. So each child is different. But the basic issue is a triad of issue. Okay, poor social interaction, lack of communication, impaired communication, both verbal as well as non-verbal, unrestricted and repetitive behaviors, rigidity of activities, interests, very limited interest. And that leads to a whole lot of, so you see, when you see, hyperactiveness, or you see hypersensitivities or hyposensitivities, or you see tantrums and meltdowns, all of these are a fallout of those three problems, the triad. And why do we really have to worry about autism? There are so many other disorders in the world. Why autism? Because the number is increasing in epidemic proportions. We had a COVID pandemic, and it is easing out, hopefully. But the pandemic of autism has been there for a while, and it is growing. But not much cognizance has been taken of it. So we, as those who will know about it and understand it, need to emphasize the importance of really looking at this problem in more depth. So just look at how it is increasing. In 2004, the prevalence as per CDC Atlanta is 1 in 166. And now in 2018 to 20, in fact, 2018, 1 in 59, and now in 2020-21, it's 1 in 50. And the COVID pandemic has further added insult to injury by giving the environment for autism to flourish. So autism is autism self-involvement, and because of lack of social exposure, now children are regressing. I'm seeing 18 months, 2 years, 2.5 years, children were all right till 1.3 or 1.5 regressing. So that's an unfortunate, very, very unfortunate scenario, and that's why very important to be taken seriously. 70 million people on the world, 1% of the world's population on the spectrum. Maybe this is an outdated statistics, maybe it is much more than this. We keep asking why child, why me, how? We not have all the answers, but we can just try and speculate. So ASD is it's a combination of genetics and environmental factor. It is not just about genetics or not just about environmental. It could be both or either, but generally both. Genetic, there are a whole lot of genes which could be associated with autism. Not really maybe the causation of autism, but associated with autism could push it. Like, for example, even diabetes, hypertension is genetics, right? So but the environmental factors, how we live our life also sort of helps manifest the problem. We have seen sisters having autism. We've seen triplets having autism. We've seen many children in the family also having autism. So yes, somewhere there is a genetic background. And environmental causation, which, yes, there are prenatal causes, there are intestinal dysfunction, which could stimulate or add on to the problem, exposure to toxic chemicals, use of mobile phones. There is a lot of discussion we can do on that, but I want to go on to the treatment part finally. So just shortening that, because I could always answer that later. So the treatment that we do is based on a brain scan or imaging. We believe that whether it is hypoxia, or whether it is a genetic factor, or whether it is gut, or whether it is mobile phone, whether it is exposure to toxic chemicals, whatever may be the reason, what is actually causing the problem? What is causing the problem is the problem in the brain. There are different areas of the brain which are functioning less. So you can see the PET scan, the blue areas that you see are functioning less. When you see the blue areas, this area which my cursor is showing, the cerebellum. The cerebellum is the area it's like a traffic police of the brain which controls the whole brain activity. So this part of the brain is actually if all the information is coming through, but it is not diverting it to the right place because it is not active or not functioning. So for fine motor activity, coordination, balance, articulation, tongue movement, lip movement, chewing, swallowing, puckering, sucking, all of that is cerebral. Now, the part here in the center is the mesial temporal and the thalamus. So mesial temporal is the area of hippocampus and amygdala. Hippocampus is for learning, understanding, comprehension, cognition, understanding, and socialization, emotional expression. And thalamus is for basically processing of information between the right and the left brain. So this baseline study has been published in the World Journal of Nuclear Medicine, where we see something very interesting, that this blue line here is the line in neurotypical children. You can see that the brain functioning is increasing, and after a point, it increases very fast, and after 10 years, increases, however, slowly. In children with autism, many a time the brain function is actually quite high, but it keeps on going down. So though we say it is a neurodevelopmental disorder, somewhere after a certain time, there is some mild amount of degeneration which is happening. So we've seen in older children, the brain is worse. So that's why if you see at some point there is a crossover, and you can see as time increases, the gap increases. So early intervention is very important. We need to intervene here early so that we can push the graph up. Are we doing enough? Most of the medical interventions are catered towards rehabilitation or medical intervention. Really, the problem in the brain is rarely, if at all, addressed. With stem cell therapy, we are able to see that we are able to help over 90% of the children, improving to different extent. We have treated over 3,500, and we are, bit by bit, bringing out the publications, 2 publications already, first with 32 patients and another with 200 plus patients, showing, looking at different angles, different, whether age is important, whether, so let me see if I have that information out here. This is the first publication, first ever in the world, that NeuroGen showed that stem cell works in autism. And here you can see that we have seen that the blue areas, you can see the dark blue and blue areas are becoming less after 6 months. It takes at least 3 to 6 months to see the changes in the brain. So it's very important. That is the time where the most active therapy needs to be done. Again, you can see that the blue areas are becoming green. These are PET scans which show the changes. This is another, the second paper that we published in 2020 in American Journal of Stem Cells, where we talked about 200 plus patients, 254 analyzed in detail with the treatment that we are doing, a combination of stem cell and rehabilitation at this point. So we see improvement in all these different areas. So we see improvement in social interaction, eye contact, attention concentration, reduction in stereotypical behavior, aggressiveness reducing, hyperactivity reducing, self-injurious behavior reducing, sitting tolerance becoming better, command following becoming better, speech improving, and communication. So there is a holistic improvement in most children over a period of time. Clinical measures, outcomes, we see improvement in ISA and CARS. ISA is the Indian Scale for Autism Assessment, and CARS is a childhood autism rating scale. So these are clinical scales to see where in the spectrum the child is and whether the child is moving from moderate or severe to moderate and moderate to mild. And parents ask, how do we see the changes? Will my child be completely all right? So it is a process. It will happen, and it will happen faster than what you would naturally expect to happen. And that's where the time scale becomes lesser. Now, based on severity, if you look at severity, we have treated more of mild and moderate cases, a few of severe cases, and we do see about 93% of children of both categories, improve after the stem cell treatment. Based on the age, earlier the better. We always say less than 5 years are the best results. Almost 98% of the children do show improvement. Now, the improvement in out of the 98 could be anywhere between 10% to 15% in the first 50% in the first 6 months. In 5 to 10 years, about 94%, and between 10 to 15 years, about 90% of the children show improvement. So even if we take conservatively, we do see that about 85% of the children above 10 years do improve. Best results before 5 years. Gender-wise, we see equal improvement, both males and females do improve, but of course, autism is seen lesser in females than in males. That's why the numbers of males are higher. Now, how soon do you come after diagnosis is, of course, also important. The earlier you come, there are children who come to us and get diagnosed. So almost 100% of these children improve. Those who come between 1 to 5 years of diagnosis, 95% of the children improve. And those who come after 5 years of diagnosis, so obviously their age is also more, about 90% of them improve. So about a 10% would not improve. And the evidence. Now, many parents say, doctors tell us there is no evidence. It is still an experiment. There is no evidence. Look at the evidence. The first ever publication from India, from NeuroGen. Second, immediately followed by that from China. Third from Italy. Fourth from US. Fifth from US. sixth from India, seventh from Panama, eighth from Vietnam, ninth from Iran, 10th from US. So 2 of these 10 publications are from Neurology. So there is enough evidence. Of course, these are different types of stem cells, but then of course they have their own plus and minuses, but there is evidence to say that stem cell does have a positive impact on autism. And these are all our publications. All of them are available online. Please do go and have a look. And overall, there are no contraindications. We can do it with other treatments as well. The only heads up is that chelation, of course, if we can stop a couple of weeks before would be better, because chelation kills the cells. So if we can just stop for some time, biomedical treatment also a couple of weeks before, because sometimes the omega fatty acid may cause blood thinning effect. So just you need to stop for a short time and restart after the treatment after maybe a gap of a month or so. Let's see a few examples. For a few examples, this is a child who can now follow commands consistently, and his child is improved after this is a change in 6 months. A child who would not sit in one place is more responsive, follows simple tasks. Okay, and this is a child who has improved beautifully with stem cell therapies from South Africa. He was practically non-verbal, but now he can make his own stories extempore and records it. He has this now obsession about recording. I mean, perfect at recording his own. Yeah, I hope I have this somewhere. Yes. Now, this is a sweet child.
Once upon a time, Peter Kid was walking down the street and his friend knew white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes. I love my white shoes. I love my white shoes.
Can you imagine? So this is the same child I showed you in the previous video.
He's standing in a large pile of strawberries. What color did it turn his shoes? Red. Zippy gray. Goodness, no. He can walking along and sing.
I think this is a 3-minute video, and of course, I'm not going to show you all of that. But so just want to read out what the mother was in November 2020, when we were in midst of the COVID pandemic. Suddenly, I got this message from Lavon saying that Zachary Jacob's mom, do you remember that? I just wanted to say thank you for all the support towards Zachary and his development stem cell treatment in his foundation years. This is very important. The foundation years was really crucial. I'm sending a video to you of Zaki telling a 3-minute story completely on his own with no prompting. There are language and pronunciation issues. As per the mom, I couldn't hear any of those, but he has come a long way from being almost non-verbal, saying only a few single words when he first came to India. So he came at the age of 4 years, then 5 years, and then I hear from her after 2 or 3 years, he's now 7 and 8 years, going to a regular school, reading much better than his peers. So that's an example. Many parents ask me, has a non-verbal child treated by you been followed up? And this is the follow-up that I have for you. Cerebral palsy. So cerebral palsy, as we know, severe damage to the brain. There are different types of cerebral palsy depending on where the brain damage occurs. This is the PET scan showing the black areas are dead areas. You won't find this in autism, but you will find this in cerebral palsy, that there would be black areas, so dead areas, but the blue area that you see are areas which are functioning less and hence salvageable. The current treatment options is, of course, rehabilitation, medication to reduce spasticity, orthotics, surgery to reduce the spasticity again, rehabilitation and injection like Botox. With stem cell, we are improving the brain functioning again, and we do see over 90% success rate in these children again. And we will see a few examples. What are we seeing? We see improvement in neck holding and sitting balance. So it starts from here. Cognition, understanding, okay? Sitting balance, neck holding, ability to hold your trunk better, trunk balance, and then hand functioning and reduction in tightness of the legs or improvement in tone of the muscle, ability to stand and walk, oromotor, tongue movement, lip movement, chewing, swallowing, and then speech. So depending on the level of the problem, you will see the improvement. This is unpublished with 262 patients, which we have studied, still to be published. Improvement, all these different aspects, improvement in scores and quality of life, and brain functioning improved on PET scan. You can see the severe damage here. You can see the green part improved. You can see blue becoming green. So this is the published study, and these are all other publications. And let us see a few examples. This is a child who came to us from Nigeria. He was a patient of chorioathetoid cerebral palsy because of jaundice, and hardly could sit, had severe behavioral issues, no cognition, inability to even hold his body upright. So before the treatment, completely no control. And now you can see sitting on his own. This is within a month that you see. So slowly this, with stem cell rehabilitation, trunk control improves, and ability to hold your body, better voluntary control. That's what is a term used in cerebral palsy, better voluntary control, better neck control, ability to use your hand. And of course, you can see earlier, with balance, more stable. And then we teach him to hold things and use, which he's now able to attempt. In intellectual disability, again, it's a part of neurodevelopmental disorder. So the focus or the strategy is the same: improvement in cognition. Again, PET scan does show us areas involved in different parts of the brain affected. Over 84% the success rate in intellectual disability, improvement in all these different domains of cognition, memory, problem solving, understanding of relationship, social inhibition. So many of these children don't know how to behave in front of others. They do not know how to take care of themselves. It's not that they don't socialize, but they don't have any inhibitions. Toilet training, very important. So again, first in the world to publish a proof of concept paper showing use of stem cells in intellectual disability was published by NeuroGen. I don't think there's any other publication in the world showing this. The blue areas here becoming green. So you can see before the treatment, 6 months later, at least 6 months to see the changes in the brain. But this may change soon with the advent of the integrative therapies. So you can see this blue area. You can see there's a brain here. Just look at the brain. The brain looks like it's been eaten by mouse, isn't it? I'm like, just look, it's so low performing. All you can see, it doesn't look healthy. Even I don't have to tell you green and blue. You can just see it's not healthy. So this is before the treatment, and you can see the lower one is just more healthier. You can see that it is just more flourishing, and that's what the cells does to the brain. It flourishes the brain. It helps the brain to become more active. We can see a part of the brain is damaged, working less. Your brain thinned out, cortex much better, thalamus, cerebellum. So most areas improve. And these are the publications all from NeuroGen. Some of them are case studies, and one is a series. Down syndrome, again, though it is a genetic condition, we know it is trisomy 21. The 21 chromosome is 3 numbered, and thereby there are many other defects. There are not only brain, but also the way they look, dysmorphic features. Also, your neck is small, cardiac defects sometimes, even bony defects, duodenal atresia, glossy tongue, thyroid problems. So the other medical conditions and surgical conditions have the treatment, they have to be treated, but the brain function is what we are looking at to improve. There is no cure, but we can help improve the quality of life of these children. Again, this is a case report that I have published. You can see here can see the blue again. We can similar areas are affected. Functioning of the brain in terms of cognition, processing of information, articulation again is affected in these children. No major side effects. So are there any complications? I think that's the first thing parents ask me, and rightly so. They say, okay, we accept, stem cell may work, it may not work. But what are the complications? These are cells that we are putting in our body, in our child's body. We need to be sure. You are right. So no major side effects. Why? Because these are the child's own stem cells. We are not taking cells from outside. We are not multiplying it. We are not subjecting it to any chemical exposure. All we are doing is segregating the cells, injecting into the spinal fluid, and the spinal fluid, the cerebrospinal fluid itself is a very good culture medium. It helps the cells to multiply. The cells multiply in a natural environment. No neurological deterioration, but we do see that children who have a history of seizure or whose EEG is abnormal, they do have a 3% possibility of having a transient seizure or increase in the seizure. It is a possibility. Knowing the possibility, those who have that potential, we would suppress the seizure activity with medications. So that is very important. Spinal headache, yes, spinal headache is something we do see with 330 or 40 patients in a week. 1 or 2 may have a spinal headache. So the headache is such that when you sit, you have a headache. When you lie down, you feel better. So most children or even adults would prefer to lie down rather than sit up because they'll feel dizzy. And it is a self-limiting. It takes 2 to 3 days to become all right. Fluid and hydration is the key for it. So that's why we keep the patient for a week. Many parents say, oh, my child will not stay in the hospital. Can we go after the treatment? That's why I suggest to them, wait. We need to be sure the child is all right. When you go back home, you should not have any problem. So yes, spinal headache, sometimes nausea, vomiting, and local pain. Now, what is the recent advancement on these? Many of you have listened to stem cells, do know about the combination of stem cell with rehabilitation. So what new is in the foray now? Now, we do have a combination of what we call as integrative therapies. They work integratedly. Some of these, disclaimer here, some of these are only for adults. But I will concentrate more on what is important for children. So just give you a brief so that, as parents also, many parents who come with the children also want to take this for their own health. So here we are also focusing on wellness and good health for everybody. So hyperbaric oxygen, I will be talking a bit more detail on it. This is an ozone sauna. Many of you must have seen a sauna like this. There's a steam sauna. So in this steam sauna, we put ozone. Okay, so ozone sort of percolates through our skin as well, so that it enhances the skin's oxygenation system. Here that you see is a hydrocolon therapy. I think many people have been waiting for this. Even I am waiting for this. This is basically complete gut cleansing. It cleanses the intestines, the large intestines as well. But this again is only for adults. Whole body cryotherapy. This is for muscle pains and joint pains. So it is like, freezing in -190 cold and then for 3 minutes and then thawing it. Many wrestlers, many sports people take this after they, go through a bout of boxing or wrestling, and, after a lot of muscle activity has happened. Infrared sauna here. Infrared sauna is using of infrared rays rather than heat to give you a sauna effect. Basically, detox. All the sweat removes the toxin, but without the heat. Acupressure, pressure points on our body will really help stimulate various organs inside our body as well as stimulate blood supply. Micronutrient therapy, vitamins, intravenous, again for adults, and pulmonary rehabilitation. This is sort of a little bit more geared towards wellness and post-COVID rehabilitation as well. Now, let's look at hyperbaric oxygen therapy. Now, there are different types of hyperbaric oxygen therapy chambers, but the basic principle is the same. What is the principle? The principle is that improving oxygenation of the tissues throughout the body. It floods the body with 100% oxygen, administers oxygen at a pressure higher than 1 atmospheric pressure. Oxygen is carried by the plasma in addition to the hemoglobin, and it increases the stem cell count multiple folds. Now, let me put it very simply. You and me, we are breathing air. Air contains 20% oxygen. Even this 20% oxygen or air that we are breathing, most of the time is not clean. It is not toxin free. Now, we let us consider it is toxin free, and we are breathing normally. We are not breathing optimally. We are not really taking deep breaths. Like so, this 20% oxygen gets absorbed by the blood, but only the red blood cells in our body, right? Only the RBCs carry oxygen. So, what are we doing here? We are forcing in 100% oxygen, not 20, 100% oxygen. We are breathing normally oxygen at 1 atmospheric pressure. In adult, we're giving 100% oxygen at higher atmospheric pressure. It goes up to 1.5, 1.75, sometimes 2, depending on the condition that we are treating. So as the pressure increases, oxygen not only goes into the blood cells and hemoglobin, it gets percolated in the whole of the plasma, the fluid medium of the blood, so that the oxygen can reach from skin, hair roots to your toes. So everywhere the whole body is flooded, so the oxygenation increases, the rejuvenation capacity of our body increases, the stem cells in our body get stimulated. And the stem cells that we have put thereby also get replenished and rejuvenated. So here you can see normal pressure, you have oxygen in so much volume, and in hyperbaric pressure, so much oxygen in lesser volume. So here we can see, this is the RBCs, you can see the oxygen here, and in hyperbaric, you can see oxygen flooding the blood or the liquid part of the blood. Okay, so normally you have oxygen which is going, you can see there's oxygen, and here you can see the whole brain is flooded with oxygen. So oxygen goes even where the blood flow is inaccessible. So what does it do at the cellular level? So cellular level, now parents talk to me about genetics, about DNA, about mitochondria. So let's talk about DNA now. Now the DNA has telomeres. Telomeres are the indicators of cell multiplication and cell growth. So when cell divides, it divides at the telomeres. Okay. Now this telomeres, with age, they become shorter and shorter, and they die. When telomere dies, the cell dies. So what is now? So it is the indication of biological age. What is oxygen therapy doing to it? This telomere length increases. So if you say that when the telomere becomes shorter, the cell dies, what does increase in telomere mean? That the cell life is increased. The cell is more rejuvenated. Cell remains alive for a longer time. So we're increasing the age of the cell. When we increase the age of the cell, that means we're increasing our biological longevity. Okay, so that's where it is helpful in anti-aging. We'll talk about that. So at NeuroGen, this is how we do the hyperbaric oxygen therapy. This is a mono chamber. So only one patient can go in at a time. There are other places where there are multi-chambers. So in one room, there would be multiple children sitting with a helmet through which oxygen goes in. We decided against that. I mean, there are pros and cons to both. We found that this works. Here you can see there's a television outside. So you can play YouTube, you can play whatever the child wants. And here with the child, one parent goes in. So you are actually getting, not only the child is getting hyperbaric oxygen, the parent is getting hyperbaric oxygen at the same cost. So 2 people, 1 cost. just kidding. So here the child is sleeping nicely. Many child enjoy. There is a child who, in fact, said, "Oh, I'm going on a plane. I'm going on a spaceship. I'm going on a rocket." So actually enjoyed the session. So the child goes in. There are a few children who do resist this process. Then we have different ways of helping the child go in by trying maybe a little bit of sedative initially to help the child because of anxiety. The child is fearful, that's why. But there will be a small portion. Most children enjoy it. They may initially be restless, but they settle down. So go inside. Slowly the pressure is increased. There may be a little bit of ringing in the ear or the ear, membrane going up and down. So that shows that the pressure changes are happening. And slowly we start with 1.3, next day 1.4, 1.5, like that. We increase the pressure inside. The first session starts at 30 minutes, then 40 and 1 hour. So about 10 sessions of this is required to bring about cellular changes. So hyperbaric oxygen increases telomere length and decreases immunosenescence in isolated blood cells. This is a prospective study which has shown that the telomere length increases and thereby reducing the age of a person by almost 10 years. In muscle injury also it has been used for recovery of exercise-related muscle injury, hyperbaric oxygen. So any injury also, recovery is helped by hyperbaric oxygen. Sports, so it all started with sports and started with actually scuba diving, decompression. When naval divers would come out, there would be injuries. So for hyperbaric oxygen, it is non-hormonal treatment approved by FDA for repair regeneration of human tissue. And it has been found to be beautifully working in traumatic brain injuries. Low pressure HBOT and physical exercise improves pressure pain threshold, endurance, functional capacity, as well as physical performance. It reduces fatigue and as well. Now in autism, the studies in autism also, okay, it has been found to be a safe, minimal improvement, maybe not very significant difference in one study, but in another study, it has been found to have good improvement in social development, fine motor activity, hand-eye coordination, language development, self-help skills. So it has been found to increase nitric oxide synthase in the bone marrow, which causes stem cell mobilization and endothelial progenitor EPC release. And it has been shown to enhance the engravement of the bone marrow and improve the effect of stem cell therapies. It helps the homing process. It increases tissue oxygenation, angiogenesis, epithelialization, increases focal and inflammatory reaction to oxygen. It post-transplantation, the bone marrow-derived cells retain a better microenvironment. There is a decrease of inflammatory cytokines and increase of multiplying cells or stem cells after HBOT. And this, some of the studies have been done in bone marrow transplantation, but when we connect all the dots, we find that the stem cell with HBOT and with rehabilitation would work beautifully. It reduces inflammatory cytokine production. Okay, it helps mobilize the stem cells in the body. Increases stem cell proliferation, angiogenesis, wound healing in mice. So because I'm putting this ahead because there have been many parents who have had who've been told that stem cell is hampered by oxygenation, and I just want to clarify this this confusion. I won't say it is wrong information; it is right. So when cells are multiplied in culture, okay, so there's a difference. There's a distinction because I'm a cell culture person. I can give you that information. When stem cells are cultured in the laboratory, okay, in vitro, there the cell growth is enhanced by low oxygen concentration. Okay. However, in the body, the oxygen concentration required is higher. We have seen, so if you give more oxygenation, the stem cell in our body multiplies. So obviously the stem cells that we are putting in the brain will multiply as well. Okay. So in autistic individuals, we find that, and in different conditions, we find that hyperbaric oxygen helps in improving oxygenation in the brain, improves metabolic activity in the brain in our body. It helps in oxygenation of nerves and muscles also. It improves overall metabolism. When multiple sessions are taken, it stimulates body's own mechanism to produce its own stem cells at a faster pace, which help in healing and repair and wear and tear. So it supplements the stem cell treatment. Overall in wellness, helps in anti-aging. So there are various conditions that can be treated by HBOT. But yes, there are certain exclusion criteria. Where can we not use hyperbaric? Active seizures. Any child having seizures every day, it's a bit risky. Any visible metal implant, outside, if there is a visible metal implant, because oxygen and metal don't go very well. Ear perforation or ear grommets, because of the pressure changes, we do not suggest that such children or individual undergo stem cell hyperbaric oxygen therapy. lung fibrosis, lung injury, recent lung surgery, cardiac surgeries. Those who are on oxygen support, acute ear pain or ear discharge. Those who have claustrophobia obviously cannot go into that machine, and deranged vitals like blood pressure going up and down, heart rate going very high, very low. So yes, those would be then we would be checking all of that before suggesting or putting the patient inside the hypothermic chamber. So this is how it will work. Sorry, I think it is slow. Yeah. So this is how the chamber, pull out the stretcher, the person goes in. Generally for children, we send the parent in first so that the child has some confidence, and then the child goes in. So this is the earthing thing which is put on our hand. It's a band. So that is put in the parent's hand or the helpers. If parents can't go, we do provide helpers here. When the door is closed, it's a glass chamber, so you can see outside. You can always talk. Whatever you say is heard outside. That person is always monitoring you. There is a television there outside where you can see cartoons. Children love to see cartoons there. That is their cartoon time. Otherwise, we don't give them screen. Once the dive, it's a dive. So once the dive is stopped, it takes about 6 to 7 minutes for the pressure to normalize and for the door to be open. So hence, we are very careful whom we put inside, because stopping becomes is not instantaneous. So now, ozone therapy. People know about hyperbaric oxygen. Now, ozone is something where people wonder what is ozone. Okay, so now here is ozone therapy. So these are different ways that ozone can be given. So as I told you, ozone sauna. You sit here nicely, your neck coming out. Ozone is along with steam, and you get nice warm ozone. This is the ozonator. So oxygen in the cylinder is connected to this ozonator, and the O2, two molecule of ozone, is converted to O3. This is the active molecule. It is unstable, and when you put in your body, it divides into an activated oxygen and an O2. This is a BOTO. So this is a way of giving ozone for those who have chronic sinusitis or lung issues. And BOTO can be given like this. This is an oil, either olive oil or a normal groundnut oil and ethyl oil, and ozone goes through this, and the oil fumes are then inhaled through a nasal prong. So what is the principle of ozone? 100% medical grade oxygen and ozone combination, 98:2, supply higher amount of oxygen to the tissue at the cellular level. Again, okay, this is a different way or different mechanism of increasing cellular repair. It is an excellent antioxidant. It is an anti-inflammatory. It is an anticoagulant. It thins the blood, and it is a germicidal. It kills bacteria, virus, fungus, parasites. So it's been used in tuberculosis. We use it in COVID. We use it in COVID. I have taken ozone myself as an immune boosting, to improve my immunity, to be able to fight against COVID. So we were a COVID hospital for 5 months, and all of our staff was given because vaccine was not there at that time. So this was for us a default vaccination to prevent COVID in us. And those who were afflicted with COVID also got this ozone, and they recovered beautifully. So ozone improves oxygenation, regulates oxidative stress, regulates prostaglandins, it immunomodulates, it's an excellent germicidal and metabolic. If you give it through gut, it activates antioxidant system of the body, reduces oxidative damage at the cellular level. All our diseases arise from oxidative damage. So oxidative damage is reduced. It reduces inflammation in the brain and the body, improves oxygenation, improves gut health, does potent anticoagulant effects. So how can it be given? It can be given as per rectal insufflation. So just like an enema. So there is a small, not plastic, ozone eats up the plastic. So it's a plastic-like transparent material. So in that, ozone, like a gas, is filled up, and then that is insufflated via a enema tube into the rectum. So it's like a 5-minute thing. So that means when the ozone goes into the gut, it immediately separates into, because it's a very unstable molecule, converts into O2 and O plus, and then it gets absorbed into the gut, and it kills the unwanted bacteria, and it starts stimulating a immune what to say a healthy immune response. Then ear insufflation, like through the stethoscope. This ear insufflation helps the ozone reach the brain directly. Breathing through oil, which I showed you, intravenous ozone saline. So saline is ozonated and then intravenously infused. Ozone sauna, which I showed you, at local sites. For example, if there is a wound, we can do a funnel bagging or funneling. If there is people who have hair problem, hair loss, we do funneling for hair also, local application. There are these ointments which I give my mother-in-law for knee pain or joint pain. It helps there also, wound healing. We can inject intramuscularly as a immunization. We can inject into the knee joints. We have tried for slip discs or disc pains, injection into the into the spaces. Inject into the if there's a frozen shoulder, into the shoulder, major auto and minor auto, mixing with blood and injecting and pack. Both Dr. Sharma and myself, we have taken all of these. Ear insufflation, you can see through the ear. This is Boto, sauna, intravenous. This is Dr. Sharma giving intravenous ozone to a COVID patient. So ozone acts as an immunomodulator. It's an inducer of antioxidant enzymes, an inducer of endothelial nitric oxide synthase, and an activator of stem cells. A consequent neovascularization, tissue reconstruction, enhances mobilization of endogenous stem cells, and it is not toxic. The atmospheric ozone may be toxic, but the medical ozone acts as a disinfectant and oxygen donor, an immunomodulator, a paradoxical inducer of antioxidants, a metabolic enhancer, inducer of endothelial nitric oxide synthase, an activator of stem cells, neovascularization, and tissue. It is amazing. I am a complete ozone buff. I am complete faith in ozone. But yes, we cannot give ozone in certain conditions. G6PD deficiency. G6PD is an enzyme which metabolizes ozone, and if there is a deficiency, so effect of ozone remains for longer time, and hence in those who are deficient, we do not give ozone. Those who have acute bleeding, because ozone is a blood thinner, those who have menses or acute bleeding, hyperthyroidism. Again, hyperthyroidism, ozone is not given. If there is a cough, cold, or ear discharge, and ear insufflation cannot be given. If EEG is abnormal or a child has a seizure, ear insufflation cannot be given. And in motor neuron disease, only rectal ozone is given, not intravenous ozone. So it can be used again for a whole lot of conditions. In generally, we suggest a minimum of 10 sessions again for cellular changes, a minimum of 10 sessions. So we find that hyperactivity decreases, command following improved, interactive play improved, understanding, perception, communication is better, gut cleaning happens. Even if they get loose motion, all the gut gets cleansed up. Understanding is improved, static balance, oromotor, ruling decrease in CP, tightness, spasticity has reduced. PET scan has shown improvement, sleep has improved. So in dementia patients, sleep has improved, able to recollect things faster. This is how the ozone is given. This is the cylinder, and you can see that it is connected to ozonator, and from here the ozone is coming into the ear and it is generated for the ear. So this is how the ozone for the ear, and similarly, so this is a small representation. Of course, deep tissue mobilization, pressure points, it improves the lymphatics and not only the blood supply, activates the parasympathetic system, blood circulation, gives muscle tension. I've gone on to the acupressure. Okay. So pressure at certain points, specific points, increases aerobic performance, of young healthy males, reduces anxieties, improves repair, muscle regeneration, recovery, stimulates the blood flow, increases temperature. So what do we generally recommend along as an integrative? 10 HBOT, 10 ozone, and 8 deep tissue mobilization for neurodevelopmental disorders, and for neurodegenerative condition, HBOT, ozone, DTM, and vitamins. And gut cleansing is an option. So this is NeuroGen Brain and Spine Institute. And we have treated over, I think now, almost 11,000 patients from 70 different countries. We had 2 hospitals now. One is NeuroGen, which is in Seawoods, very near the Grand Central Mall, and a beautiful lake. It's the operation theater. It's a laboratory, which is in the OT complex. Nothing goes out of the OT complex. The bone marrow, the stem cells, everything within the OT complex. Comprehensive rehabilitation under one roof. All the therapies, occupational therapy, Autism Child Development Center, spinal cord injury, walking tract, sensory integration, activities of daily living. We focus on that, speech therapy, special education, art therapy. And we have KLS Wellness Institute and NeuroGen Annex, where hyperbaric oxygen, NeuroGen has hyperbaric oxygen, ozone, deep tissue mobilization, colon cleansing, infrared cryotherapy, intravenous vitamins, and all other wellness. Yes, this is for adults, this is for parents, for feel good, cosmetic as well. And of course, we have regenerative laboratory for non-neurological conditions here in KLS. We are starting to do PRP for pale skin, face. And of course, this is the work that we are doing, a lot of books on neurological conditions, and now also book on COVID. This is the core team of seniors, our accreditations, certification, and our awards. So this is a combination. So what we have been finding increasingly is that a stem cell along with rehabilitation was the initial combination, and now stem cell with rehabilitation and integrative therapies is helping enhance the effect of each other. So I keep on using this word combinatorial. It combines and it enhances the effect of each other and works very beautifully with each other without compromising each other's effect. And that's where our confidence in this combination has increased over 1.5 years now. We're seeing very good results. I'm pleased to visit our website for more information. We are available on this number, as well as contact at neurogenbsi.com. Each patient is, when you reach us, a coordinator is appointed who would be taking care of all of your requirements. 2 weeks program or 1 week, depending on what you choose. And why NeuroGen? Because we have the largest number of scientific publications in the world. It's 95 here, but we have 106. We have international book editors who have introduced book chapters on stem cell from NeuroGen and various conditions. We are the only stem cell therapy world that works only on neurological condition at NeuroGen. We use safe autologous cells and inject it intrathecally, which reaches the target area. Combined stem cell with comprehensive rehabilitation, treated over 10,500 cases in the last 13 years now. A combination of senior and experienced professionals from across specialties. We continue to research for new treatments and evolve the treatment, and we have a government-approved institutional ethics committee. So what we use is adult stem cell in combination and It is a safe and effective treatment with no long-term side effects. And though we have been doing for 13 years, and still, of course, there is a lot of disbelief. And we believe what Nandini ji said, to believe that what has not occurred in history will not occur at all is to argue disbelief in the dignity of man. So we continue to believe in the possibilities of regenerative medicine because we've seen it happening in front of our eyes.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
Ending with, on a positive note, of ex-President Obama, when he became the president, lifted the ban on federal funding for embryonic stem cell research. And even then, the thought that stem cell is banned in the US is not gone. So just to remind people that, that was history. So anyway, thank you so much for being here on a Saturday, possibly your holiday, and being there throughout the webinar. I will be now taking questions and answering, question answer. Yeah. So I have a couple of questions here. Neil here says my daughter has not has speech difficulty anymore and is very much neurotypical in terms of speech, but she has diagnosed with autism while she was 4 and non-verbal when she regained her speech. My problem is she's having jerks and pitch that are not in her control. It's non-epilepsy, and as I had done 7 days, what can be done for jerks and pitch? Another tumor, and what cause if it's not epilepsy? You need to show to a neurologist. They would tell you what could be the. I think increasingly now we're seeing in children some involuntary movements or tics, or sometimes in one child, in fact, a Tourette's was diagnosed. So you may need medications for that. You could send us all the details and I will review it. She's still on spectrum, very much antisocial. Everything needs to be answered for her. She doesn't accept no for an answer. Why can't I watch? I don't believe. It's always arguing and questioning. I think it is not antisocial on spectrum. She's a growing up child. Maybe she's in her teens and she has her own mind. And sometimes we have to accept that a child with autism will also have questions like a neurotypical child, and we need to answer patiently. So, forget about the autism diagnosis. Look at her as a regular child and answer her questions. I think children now are very argumentative. So she's a normal child now. How autologous stem cell transfer works on person ASD linked to chromosomal deficiency. Similarly to any, so very few of the children that we treat have undergone gene testing and all chromosomal. As I said, even in Down syndrome, there is a chromosomal deficiency, not deficiency. In fact, there is excess of chromosomes. So any even chromosomal defects or even genetic defects, the problem may be in the gene, but environmental factors also contribute to the development of the condition or manifestation. If you see two triplets, if you see twins with autism, even in those or 3 people, the manifestation is different, though the genetic defect may be the same. Understand? So it is important to understand that the gene defect may cause the initial problem, but what has happened is the change in the brain. So the focus of our treatment is the improvement in the functioning of the brain, irrespective of the genetic defect. Okay, we can't really change can anybody change the gene? Can anybody change the genetic defect? Or even if we change, can you change what has happened before you have changed the genetic defect? So changing the genetic defect will not really improve whatever has gone wrong. So here we are focusing on the functioning of the brain based on the neuroimaging or the PET scan. A doctor currently having epilim medicine, low dose, 3 ml at morning 9. If we do stem cell, need to stop this medication for a few weeks or can continue. Please continue. Do not stop essential medications like anti-epileptic should never ever be stopped. Thyroid medication, if any child is on thyroid norm, please do not stop. Only what we are suggesting is only nutritional supplements you stop. But other things, if and when you are coming to us, just check with a doctor. Okay, do not stop anti-epileptic medications at all. Even you can continue risperidone, you can continue methylphenidate, whatever melatonin. Do not stop any of these medications. Do you need any medication after surgery? Number one, it's not a surgery, Aqua. It is just a procedure. So yes, the medications are very few. What we do give is 2 days of antibiotics, a bit of painkiller and antiemetics to prevent gastric irritation. Okay, that's all that is required. If there is vitamin D deficiency, we may start on vitamin D. We do give sometimes probiotics. Anybody who's on anti-epileptics, we continue the anti-epileptics. People who are on medication for hyperactivity, we would continue that. How much does everything cost? One of my coordinators will get in touch with you and will help you with the logistics of the cost. This is an academic session, so I would be taking questions on the treatment procedure, any medical questions. Thank you, Sheila. Sarat, my son is 14-year boy. Do hormones impact cell therapy efficiency? Is diagnosed with age. Now let us look at a 14-year-old child. Now 14-year-old individual, one, has the brain development is still happening, but it has reached is almost 90-95% potential. And there are hormonal changes which impact the brain functioning and the behavior of the child. Plus, in 14 years, the child has learned a whole lot of things, good and bad. So, stem cell therapy is affected by hormones. However, the result of stem cell therapy is challenged by the hormones, I would say. So, it's a challenging time. We have recently treated a 12-year-old boy with, I just was talking to the mother yesterday. He's come for another treatment now from Africa. And this boy, when he came last time, apparently he was all over the place, running around, looking at things, not sitting in one place, shouting, getting excited. And after the treatment, when they've come back now, this time he came with the mother, very calm, very quiet, standing in the line. Unless he said anything, nobody really knew that he was autistic. So it depends on where is your child, how is your child, is he very aggressive, is he very difficult to manage? Then it is not that stem cell will not work, it will work, but definitely the possibility or the percentage of result will be lesser, or it will take more time. But yes, we can do stem cell for a 14-year-old. We would like to evaluate the child's condition to be able to give you a realistic expectation. What can we expect in this boy? Is stem cell therapy useful in ALS patients? So Maheshwari, yes, we do treat ALS patients with stem cell therapy. The results, like for example, in autism, the results are almost 90-95%. In ALS, the results we have found is about 50%. We find that 50% of the patients, we are able to slow down the deterioration. It may not stop completely, it may not reverse, but slow down the deterioration in 50% of the patient. Our research says that females who are in premenopausal stage without any bulbar symptoms, no speech following respiratory issues, respond better than males and females who are postmenopausal or those who have bulbar symptoms. So younger patients respond better. You could reach us and we would like to evaluate the case based on all these variables. Farooq says, my son is 12 years old and has 17q12 microdeletion. This is renal cyst and diabetes. However, it also causes autism. He's non-verbal. How effective will it be? Will we need to get all this kind done in home first. Farooq, does he have renal cyst and diabetes? We can, if the medical issues are controlled, if the diabetes is controlled with medications, we can definitely treat autism. In a 12-year-old, our focus would be to help the child attain improvement in terms of comprehension, understanding, ability to take care of himself. If he's completely non-verbal, we would first work on non-verbal communication and then verbal. Verbal communication will take time to come. Even in younger children, speech does take more time to come because that is the most evolved function in our society. So speech requires socialization. So first we need to improve comprehension, socialization. So in a 12-year-old, it will work if the medical conditions are sort of controlled, diabetes is controlled, the renal cyst is not causing any renal damage, kidney function is normal, we can go ahead. You do not need to do scans in your country. Scans will be done when you come to India. You can just do the basic test to ensure that his diabetes is, sugar is controlled and there is no kidney dysfunction. So this is what you need to take care of. Other tests and all we will do once you come here. I hope I have answered your question. Maheshwariji, we will get in touch with you and we will see how we can help your patient. Okay, cysts in kidneys are okay. Kidneys are very durable. Even with one kidney, we have treated a child with one kidney also. One kidney functioning, one kidney not functioning. So we need to know what kind of cysts these are. If these are benign cysts, no problem. So we need to have more details of that. No diabetes, that is a good thing. There are some questions in the chat box as well. How does stem cell help for child with one less chromosome kid? So again, chromosomal abnormality, irrespective of the chromosomal, we are looking at the brain functioning based on the PET scan, and we would work on the brain functioning rather than the chromosomal angle. So chromosome has done the defect has done whatever damage it has to do. Now we are going to repair the damage. What kind of sterility testing you perform before transplant? How many cells you infuse in one dose? So sterility testing, because we're taking the bone marrow of the patient, we would test the patient first. We have to ensure that the patient is not unfit in terms of infections. Any child with a viral fever or a bacterial infection will not be treated at that point unless the child is fit. Now, the area or the place where the treatment is done, the stem cell laboratory as well as the operation theater is completely sterile. It is clean, it is fumigated, and the place is checked for any kind of contamination by regular swab testing. The sample is processed in the laboratory after all the fumigation and the sampling of the sterility testing of the laboratory is done. And once the sample is removed, it is injected, separated and injected immediately. Sterility testing has to be done when it is multiplied outside the body, which we are not doing. So within a few hours, the cells go back. We have 0 infection rate so far. So that shows that the cells that we infuse are absolutely sterile. How many cells we infuse in one dose? So we are injecting cells into the spinal fluid. The bone marrow that we remove is based on the weight of the child. So says about a 20 kgs plus child, we would put about 90 to 100 ml of the bone marrow. The bone marrow was stimulated by granulocyte colony stimulating factor, GCSF injected, 2 GSF injected before the treatment. The bone marrow, the cells that come out would be in the range of 100 million cells of mononuclear cells. So generally minimum of body weight into 10 raised to the power 6 cells are injected or transplanted intrathecally. They are not infused intravenously. So when you are injecting intravenously, the number of cells that you have to inject has to be much higher because they get, they have to traverse different organs and they get filtered through these different organs. We are reaching directly to the brain, and hence the number of cells need not be too high. please guide us in spinal cord injury patient having D8 to D12. Mr. Singh, could you get in touch with us? We should be able to help you. Our focus in spinal cord injury is on motor development. We are looking at improving motor function of the patient by helping the individual to stand and walk, at least with support. So we will get in touch with you, take all your details, and we will guide you about how we can help you. Sita ji, I think I've answered your question. Mr. Singh, I have answered your question, right? Please put the question in the question and answer section. Farooq ji, about how many sessions? So how many sessions of stem cell are you asking? See, stem cell procedure, when you come and the child comes, we would look at the scan, look at the child's severity, and then advise you based on whether one is enough or 2 or 3 may be required. During the first session, in an older child with no contraindication, would definitely recommend stem cell therapy along with the integrative therapy. So that would be a 2-week treatment where with stem cell there would be 10 sessions of hyperbaric oxygen, ozone, and 8 sessions of deep tissue mobilization along with rehabilitation for the 10 days. So how many times the treatment will be required will be based on the clinical assessment on the PET scan that we do when you come here. So when you come here, we will give you that advice. Akua, my son is non-verbal, possibility that he will speak. See, we'll have to see, you have to understand that speech is one of the problems in autism. There are so many other issues which are underlying. We need to first assess the level of functionality of a particular child. If it is a severe non-verbal child, our focus would be on making the child independent. If the child is independent and has some amount of comprehension, we can definitely work on the speech. So we need to first understand how severe your child's condition is. Let us look at speech issues. Speech issue can be because of brain functioning, which we see in children with autism, or it can be because of inability to hear. Individuals who are unable to hear can also not speak. However, they can live a complete, fulfilling life despite not being able to speak because their comprehension is good and they're able to carry out their life skills completely. So in autism, let us not, make a distinction of verbal and non-verbal. We need the individual to become independent, and it has to be stepwise. So speech will come ultimately, but before that, comprehension, ability to have non-verbal communication, need to socialize, motivation to socialize, wanting to talk to people has to come before speech will come. And speech will come when there is motivation. Yes, there is a possibility to speak. Possibility to speak will never be ruled out. It is possible. We have had a 13-year-old who does vocalize. I will not say speak, but does vocalize few things. Yes. Mr. Singh, I have answered your question, I think. Farooq ji, the coordinator will contact you today, maximum by Monday, and give you detail of the cost. You will definitely get all the information before you plan to come for the treatment. All the information about cost and logistics would be given to you by the coordinator. All details would be included when they tell you about it. If there are any more questions, please do put here. Otherwise, I will let you get on with your day today. Thank you so much for this interactive session. And still, if there are more questions, our coordinators will be reaching out to you, and whoever is interested in having a one-on-one virtual discussion with me, I would be available based on appointment. And so you will have the chance to ask all your questions even then. Thank you, Mr. Pokhrel, and hope to hear and see all of you soon. Have a good day and take care of yourself.